Chronic addictions and mental wellness remain a huge issue in our country. An organisation, though, is committed to working hard and trying to tackle the issues. The question is, where do we start? I'm joined by Asanda, Gcoyi, the CEO of Vapour Products Association of South Africa. Asanda, good afternoon to you, and I appreciate your time in speaking to us. I can't help but imagine that chronic addictions and mental wellness and mental health go hand in hand, don't they?
Yes, they do. Good afternoon, Gareth, and thank you for having me. I think when we understand addiction, I mean, when it pertains to certain substances, we have to sympathize and understand what can we do, as various organizations to combat and work towards alleviating it as much as possible.
And where do we begin this fight exactly? When we say eliminate it as much as possible, I suppose we've got to start somewhere, don't we, Asanda? Where would you start?
I think what's important to bear in mind, Gareth, I mean, the organization that I represent, Vapour Products Association of South Africa, takes into account the importance of understanding harm reduction, knowing that we cannot eliminate certain behaviors, that rather than seek to eliminate them through stringent policies and that kind of thing, we need to find ways of reducing harm. And how do we reduce harm? We find ways through policies to ensure that people have access to what they're addicted to, but in a less harmful alternative, which will then, at the end of the day, help them win off whatever it is that they're addicted to.
You'll understand the irony with some people joining us at the moment, Asanda, that you and I are talking about this, and the organisation that you represent is trying to move away from one addiction, that being cigarettes, to what some would say is another addiction of the world of vaping. Help me understand where you fit into this. It's almost like speaking to a beer company about safe driving.
I think what we know as a fact is that people in smoking, people are addicted to nicotine, but it is the tar that causes harm, that causes the cancer, etc. So in recognizing that the addiction is in the nicotine, we need to ask ourselves and say, how do we give people access to that nicotine which they crave in a less harmful alternative? Bearing in mind that some people are unable to quit, or better yet, some of them do not want to quit. So we're not going to be moralistic about it and say, you ought not to be doing ABCD, but rather to say, how do you get access to what you're addicted to in a less harmful alternative, which is where vaping comes in.
So someone addicted to something, I'm going to move away from the nicotine thing. I just felt I had to get that on record as to where you're coming from in our conversation, just to frame it. How do we begin to understand if somebody has an addiction that is mentally damaging to them, or rather having an addiction that is mentally growing and helping and supporting them? It's almost a case of it's better than the other, isn't it? How do we begin to identify a loved one that might need that sort of help, do you think?
It's an all-encompassing approach, Gareth. It's not one approach over the other. I think we see in public health how we've sought to find ways of helping individuals, and we know that someone is addicted to a substance, in this case where we are concerned, nicotine, when they're unable to function in the best way they can without getting that into their bodies. So what's important to note is that when someone is addicted, it can't be one approach that helps them. If a loved one is addicted to nicotine or to whatever else, other substance, you need to know that you need almost a village in a way, to help them to navigate this addiction. So there are clinical ways that they can navigate this addiction. There are other ways that I think is important, which is what we're talking about now, that it's not just one approach fits all. We need to be open to finding creative ways of helping people to deal with this addiction.
Let's talk about the cause of a chronic addiction in a case like this. I suppose you could agree with me or not, Asanda. You tell me. The issue with something like alcohol, the thing like smoking and in vaping, I suppose in this case, is media and social media is making it look quite sexy. It's influencing the youth, and that's where a big concern has to come in when we're developing chronic addictions in youngsters, isn't it?
Yeah, and I think it's important to note and agree that young people tend to get involved in risky behavior. It's not unique to South African young people, it's across the world. We want to experiment when we are young. But what I think what's important is that in experimenting, we as industries in these sin areas need to be more proactive in educating these young people to say, our products are not meant for you. So, for example, in vaping is a less harmful alternative for adult smokers and not for young people, which is why for us, we're saying we're not going to sell our products to people under the age of 18. And in doing that, we need to make sure that our advertising is not applicable to people who are under that age. In packaging is important. We need to make sure that the products that we have are for the individuals that they're intended to. So it's really an important fine line that as industries like alcohol, like tobacco, like vaping, we need to also play our part in ensuring that young people are not addicted unnecessarily.
That's one way in fighting chronic addictions from a young age and helping support mental wellness. Asanda, I thank you very much for your time in speaking to us this afternoon. Asanda Gcoyi, the CEO of Vapour Products Association of South Africa, is talking to us about what they're doing to try and tackle those two big issues. Right.